So today it's really fun to co-moderate this panel with Dr. Rumsey and really focus on the joy and the love that our employees experience as a result of their XR experience. So thank you, everyone. Thank you, panelists. Thank you, Dr. Rumsey.
I just want to say that is a hard act to follow, Sarah, so thank you. But this is going to be a fantastic conversation. Magic. Okay, thank you. Looking forward to this panel. This is a very rich group of experiences up here, so can't wait to get started. So, take us away.
Beautiful. We'll start with our first question. We'd like you to all introduce yourselves, please. And if you can tell us a little bit about what brought you to the VA and what keeps you at the VA. And we'll start, Ms. Scala.
Good morning, everyone. Tracy Scala, the Deputy Medical Center Director for the Orlando VA Healthcare System. I am a veteran. I'm a retired Navy Medical Service Corps officer, but I also spent 10 years in the Air Force as enlisted, and then took a direct commission into the Medical Service Corps with the Navy and finished my last 10 and retired. I won't tell you what decade I retired. But so I actually did not come to the VA right out of retiring from the military. I actually went to private industry and never used my VA benefits. And 10 years later, I decided to come to the VA. I recognized what the mission was and was very strongly drawn to it and decided that that was my next step. And I've been with the VA for 15 years now, recognizing that there is no more important mission than what we do every single day, 7 days a week, 24/7, 365. It's like being on active duty, but doing something that is so rewarding that it keeps you where you are at. I've had lots of opportunities with the VA. The one I'm in now, I think, has probably been the most fun. Orlando is phenomenal for innovation, Shark Tank conventions, and of course, the opportunity to implement and continue to expand and spread our opportunities through VR, AR, and mixed reality. So that's one of the reasons that I stay with the VA, is because we have all of these opportunities to really better the lives of our veterans, and I can't think of anything else I'd rather do right now.
Beautiful. Thank you. Mr. McAdam?
My name is David McAdam. I'm a physical therapist assistant at the Central Iowa VA. I've been there for about 11 years, and it's been a great journey. I started out in the private sector as an athletic trainer and decided that I wanted to do a little more for our veterans. And in going to PTA school, I got to do an internship at the VA and figured out that that's where I wanted to be. So again, been introduced to a lot of great things through the VA, especially VR, and would love to tell my story.
Thank you. Dr. Rodenkirk?
Good morning. My name is Katrina Rodenkirk. I'm a physical therapist and pain specialist at the San Francisco VA. I've been at the VA for 15 years, also came from the private sector. The first time I was introduced to veteran care was when I started my internship after finishing physical therapy school in Norway. And in Norway, they don't have veteran specialty care, so veterans are part of the national care system. And I dropped something on the floor and got such a response from my veteran in the bed. And he was so startled by the sound and then so apologetic that he made me scared by his reaction, and then shared with me some of the reactions and how it was living with being very startled with sounds. We didn't have PTSD, wasn't very well educated on back then. And then moving to the United States, I started working in the private sector, which was so different from working in a socialistic or national healthcare system. And so 15 years ago, I decided to explore moving into the VA as a physical therapist. And it feels like I've come home to a medical system that I very much feel connected with, love working with veterans, and have gotten so many opportunities within the VA, starting in Whole Health, our wellness program in the VA, and then moving into teaching yoga to veterans. And then we created also our own national yoga school during the pandemic, which was very meaningful. And now moving into pain care and virtual reality. So I'm very thankful to be part of the VA.
Thank you. We just love that sense of coming home and feeling that sense of home where we work. Beautiful.
And so thank you for those introductions. That really helps us gain an understanding of who you are and how you have come into contact with immersive technology. And I want to learn a little bit more about that and when you were first introduced to the immersive technology and what stands out for you in that experience. And Tracy, if we can start with you.
Sure. So probably 2 years ago was my first opportunity to engage in immersive technology. It was actually one of my grandson's Oculus. And I was watching them as they were using them, and they were doing games online, but they were using the headset, and I was just amazed by it. And so I actually asked them if I could take and use it. And so they looked at me like I was crazy, but I was like, yeah, let me try this out. And so the first thing I did was I downloaded a boxing app. And so then I realized I could take and do all kinds of exercises. And then I realized I didn't know a thing about helium, but I can tell you that's going to be the first thing I do when I get home is put the Oculus on and download helium so that I can use it. But, the opportunities, there 2 years ago is that you can use it for everything. Whether you're traveling and you want to take and just get your exercise in, if you want to use it for meditation, learning opportunities are just, endless. And then recognizing that within, my own organization in Orlando, what we're doing and how we're using these technologies to better the lives of our veterans, but also what we can take and do now to better the lives of our staff, especially after everybody's coming out of COVID. We still have the stress, clinical burnout, recognizing how we can take and help our staff. And so those are, just some of the things that we can do now, and I'll leave the rest of it for a later question. How about that?
Thank you, Tracy. And moving on to you, David, can you tell us about what is memorable about that experience?
Yeah, I was first introduced to immersive technology or virtual reality back in 2019. We had one of our local DAV presidents go to a convention down in Kansas City and saw virtual reality and came back to us and said, we need this for our VA. And so our director of rehab came to me, because I'm kind of the techie person, and said, we need to look more into this. So it allowed us to do a lot of research. COVID hit, and so it kind of shut some of that down. But during that time, we were able to look more into what really was going to benefit our veterans and find that right system that was going to allow us to be able to take care of our veterans and address their issues.
And I want to put you on the spot just a little bit. So do you remember that first experience when you first put a veteran in the headset, and maybe what they said, maybe not verbatim, but the experience, what the look on their face, how their body relaxed?
Well, just like everybody else says when they do it, there's a huge smile on their face. depending on what we were doing. I believe the first experience we took them on was a trip back in time to when they were younger. So being able to reach out and try and touch what they can see through the headset, and just that emotion that comes out, sometimes tears, sometimes laughter, but when they take that headset off at the end, it's always, that was amazing. I want to do it again.
Veterans have such colorful language. I don't know the amount of swear words that I've heard, but I've also heard things like, "This is better than acid," or "I can feel my feet are getting wet because I'm on a beach." And one of my favorite quotes was, "It feels like sunshine on my face." And that was in inpatient mental health during COVID. And to me, you can't make that up, right? I'd sit in my office for hours like, what could I say? But collecting that voice of the veteran, I think, has been such an important part of this experience, because we can't convey it as well. So thank you for that. I appreciate it. And then moving to you, Katrina. This is actually the second time we've shared a stage this year. We co-presented at a pain conference, so it's really lovely to share this space with you again. So do you remember that first time that you used VR, and what stands out for you?
Thank you. Yeah. I was a virtual participant to this conference last year, and I was just blown away. I had not used VR in patient care. I went straight out and got my own unit. I got the app called Trip, which is a beautiful way to downregulate the nervous system through breath. And they're using some yoga breathing techniques, box breathing, Brahmari breath, or bee breath. And it has helped me tremendously to kind of at the end of the day to use it personally. And then I couldn't get that fast enough into my clinic, so I ended up actually bringing my own unit to work so that I could have my patients use Trip as well. You see here on the screen my very first patient that I put into headsets after I got a good grip of what virtual reality was. He is the gentleman leaning forward, almost touching the floor. He came in, and this was in one session. He came in with a hip flexion of 90 degrees, back pain, and then significant shin splint. So weight bearing into his feet was very, very painful. So put him in headsets, and he's reaching here to grab a ball to throw to a dog. And you see here he has more flexion just with one visit. And he was so moved by the experience, leaning forward, and he still had somewhat pain doing that movement, but it has such a pain-relieving effect that it was quite amazing. So after his experience, he expressed that my pain is still a 6, but it was a 7 prior to trying this, but now I'm a happy 6.
Thank you for that. That's really impactful. I want to unpack that a little bit more, but I'm going to send it over to Barry.
So you kind of touched on this already, but let's just kind of circle back to your personal experience of this technology, immersive technology, and how has that had an impact on your view, on your ideas about its use in healthcare, specifically with veterans? And Tracy, yeah.
Oh, okay. I thought we were going to go to Barry. In my own personal life, of course, after I played with my grandson's Oculus, I went and got my own. And I actually use it quite a bit, more for the meditation, definitely for exercise. But I have found that, and for those of you that are in Gulf Coast regions, in Florida, et cetera, when hurricanes come in, you can be in the hospital working 2 or 3 days straight. And, the leadership team does not leave, and nobody else leaves. And so you're kind of there for a good period of time, and obviously you can't get outside and go work out. So I take my Oculus with me into the hospital, and I'm fortunate enough to have, my own office, and the staff knows that when we're there for 2 or 3 days, if the blinds are drawn on the window next to my door, do not come in. I have my Oculus on. I am using it just to take, like the one lady did in the video, just taking 5 minutes and, taking that opportunity for the downtime. We have a wellness center for our staff. It has a chair in it that, is like a massage chair, a Zen garden, a few other things. But we really don't have, but we will have, going forward to try to expand that and add in more, headsets, opportunities to take and use that for more than just going in and having a dark room that you can sit in and, taking a few minutes that way, but making it more available across the organization. So before I came, that was kind of the plan. Now that I know we have an opportunity for 10,000 headsets, whether we can get, all of that, but, we're all into, right now, how do we engage and ensure that our staff are taken care of. It was noted that, it costs $1.5 million for one burnout physician, one burnout nurse together. And as difficult as it is to recruit and retain nowadays, these are just some of the things that we need to concentrate on and provide that opportunity and service, to our staff so that they can take care of our veterans.
Well, and I always, reflect back on the work that we do. So we are healthcare, and when we care for our staff, then they can care for themselves, and then they can care for their families, and it's a holistic, they don't stop being staff when they go home. So I really appreciate what Orlando's doing. We've been able to partner with your team and the thought leadership that's happening there about immersive in all different types of areas. So I can see where it comes from, your leadership, your own engagement in immersive. So I just really appreciate what you're doing down in the Sunshine State. Yeah.
Yeah, I'd just like to add to that, and Dr. Shah's presentation a few days ago, and I just have that vivid image of the wildfire and how that just has stuck with me, and I'm so happy you brought it back to employee use, because we are, as staff, we are still in, for many of us, still in that kind of quasi-burnout, and we have found this technology, which is great for our veterans, is also great for our staff. So, and that's a beautiful bridge between your personal experience with VR, XR, and bringing it to employees as well. Thank you. David, what about your personal experience? And
So my personal experience kind of ties in even with work. So as we've developed our program for virtual reality for our veterans at the VA and our staff as well, we've come up with a virtual reality room. So we actually have a room dedicated for virtual reality use that we can bring veterans and staff into to perform treatments and address some of the limitations and issues that they have. And so being able to do that, it has afforded me some time to be able to look at the different systems, to be able to look at the different activities that we can use for our veterans to tie that into our healthcare. And myself as a physical therapist assistant, rehab is a big part of my life, and being able to find different ways to make that more fun for our veterans and for our staff and to decrease burnout is one of those ways that it's really impacted my life.
thank you, David. Katrina?
So in the picture that you see here at the lower corner, that is one of my colleagues in my home. So I started actually inviting people to my house to try out the VR. And also having my treatment room open during lunch for my coworkers to come and try out what we have available. And Dr. Rumsey and I, we invited all of the VI Post, all of our colleagues to come and try it when we did our presentation. And that resulted actually in the middle picture here, where one of our pain physiatrists or pain physicians wanted to see if we could use VR in the treatment room, the procedure room. So we're trying it out here on one of our nurses to see if we could use VR during a procedure. And we know that VR was often used initially in burn units for children. So we've had just a couple of tries, but I think this is going to lead to maybe putting headsets in that waiting area before medical procedures, because then they often have to wait for maybe an hour, that would be a great place to have a virtual reality program available. So, yeah.
Yeah, so that day was really phenomenal to be able to, after we gave our presentation, to then have a set-aside time where, again, any time that we can get heads and headsets and we can make that direct contact with what we're doing, what the veteran is seeing, what the staff is seeing, and it is really astounding. This was in Silicon Valley, so the number of folks that had never had a headset on, and we always take the opportunity to do data collection, like a little pre-post, right? So because we want them to know that it's not just about the technology. We're looking at building that model of efficacy, that this really does work. It can shift your mood. And Dr. Rodenkirk mentioned that it might not move that pain needle. It might not be able to drop it from a 7 to a 6 or a 6 to a 5, but there is some sort of physiological change that's happening, and that's important to capture as well. And you can capture that in terms of what they're saying, but also try to elicit that feeling. And one of the interesting feedback, I had never heard this before, so I'll share it with you, is that one of the pharmacists said, to me as she was leaving, she said, that really helped my menstrual pain. And I just think about how, we're all working so hard, and when you're in that clinical capacity that you oftentimes don't get to leave the hospital during the day. And so to really think about how we build that flow into the workday and make it okay and safe, and, kind of overcoming that culture of I'm too busy, or I don't have 5 minutes or 10 minutes. And I always say, yes, you do, because safe patient care depends on it, right? For you taking that breath, taking that moment out. So, thank you for the work that you're doing. And here's direct application, right? Head and headset idea about how to then serve veterans in their pain. So,
Dr. Rumsey, Dr. Rodenkirk, I just want to say, I think your example is a beautiful blend of bringing people into your space to share your personal use of the VR, the XR, and really how to, your enthusiasm just glows. And so, and I think that touches on something. We talked, the pain measure, the metric may not be affected, but what's the effect on the employees hosting that session? And I think that's what brings it back around. As an agent of employee engagement, is there an effect on the workforce? Is there an effect on the individuals when they have the opportunity to host or to offer this technology? And it may not have a one-time significant impact, it may, on the veteran or on the given employee, but on the individual who's hosting, who's offering that, what is the effect? And is there a sense of, I am so proud to be here at this place that's supporting me, offering these opportunities? And so I think that's something we talk about here a little bit more, but I just want to accent that regardless of the immediate effect we may witness, I think there's a broader ripple effect. The heads and headset function is that when others see it happening, they say, there's something special happening here. I want to be part of that next time I have a chance. Dr. Rumsey.
Yeah, thank you, Barry. So continuing on in that application of VR for direct patient care, so Katrina, could you tell us a little bit more about, like, we've seen the example for the gentleman on the left and in the center doing that procedural pain support, but how about this gentleman here in the upper right-hand corner? Can you tell us a little bit more about what you're doing there?
Oh, thank you. It's actually a female.
Oh, pardon me. Pardon me.
Yep. So this is my Grace, veteran Grace here had such a beautiful and touching and moving presentation on Tuesday. This is my Grace. So she, oh my gosh. Okay, here we go. She traveled 3 hours to come and learn how to use VR. Oh my gosh, I can't believe this. Breathe. So immediately after the second train, she went out and got her own headset as well, and has become an advocate for using VR as a veteran. She was so moved by what the headset did for her pain. You also see here how I use bolsters, yoga bolsters, and kind of a way to down-regulate pain before they start the session with me. Or I end my session with a relaxation through VR. I can't believe I'm not able to talk about this better. And it's truly a tool that I use very effectively.
And thank you for that. And it's obvious to see your heart for this work and your heart for veteran care. And I think I've had the experience of being able to sit with Grace yesterday, and she is an extraordinary veteran, and I loved to hear her story. But I think it's clinicians like you who have a heart for this work that advance this. And how many times that I've heard from veterans that I love this so much, I'm going to go out and get one for my own. And I really look forward to those days when we can allow them to have a headset and it's part of the clinical care, because I think it is transformative. So thank you for sharing that with us. And coming to you, David, can you share some of your work with direct patient care?
Well, at Central Iowa VA, we've had a lot of great success using virtual reality to address our veterans' limitations, whether they be functional or physical, as well as addressing some of those neurological imbalance and deficits that they may be seeing, and even affect chronic pain at times as well. Virtual reality has allowed us to bring those veterans into a world that takes their mind off of what they're doing and get them into a better place. The veterans also always talk about how, well, not always, most of the time, feel better after that treatment. Yeah. And how they're able to get out of that space. And one veteran in particular, we had in our acute patient setting, and he was in there due to alcohol detox, but was also dealing with some shoulder pain. And so one of the devices we used, we were able to put him in a headset, and he was able to go to a place. His place was the beach. And he really enjoyed being able to look around and be in that setting and see the different things and enjoy the experience. And you can just see him melt into his chair. That tension goes away, the pain is going away, he's enjoying it, he's laughing, he's now smiling, he's engaging with the conversation that we're having with him while he's in the headset. And when he takes the headset off, his first thing he says is, "How do I get one of these for home?" And so his big thing was, in going through the story, he was able to tell us more about his life and tell us why he was drinking and the story that goes along with that. And he needed a better avenue to take care of that instead of drinking. And so he goes, this would be something that I can put on when I'm at home and I get to that position of I think I need to drink. I can go to this place, take my mind off of that situation, and then bring me back to where I need to be instead of going to the bottle. So it was very empowering to see that happen, and the same thing goes for physical therapy as well. We've seen lots of great use cases for where to use it in physical therapy, and it helps us, give us a fun new way to address those issues, but it also gives the veteran improvement in their quality of life and decreasing those limitations that they do have. So virtual reality for me has been exciting, and I think it only is limited by our imagination.
And that's an incredible, powerful testament to VR, and again, building that value case to move it from the inpatient to the outpatient, to really move that continuum of care to where the veterans need it at that point of access. So thank you for that. And Tracy, I know that you don't do direct patient care, but is there something, a story that maybe has stood with you, or maybe you've seen a veteran using the VR in Orlando, or staff? Or staff.
So I really concentrate more on the staff than, I get the opportunity to do direct patient care. I don't think I've really touched a patient since I was on active duty. But, we recently, this past year in October, established our employee experience and workforce development service line. We decided that this was needed so that we could take and concentrate on our staff, again, knowing that if we take care of them, then they're prepared to take care of our veterans. And a part of that is also we want to engage, just like we have veterans experience, we want to have that employee experience. And we want them to have opportunities to voice, where they feel we can take and improve for their care while they are with us. And again, sometimes that can be 24/7, 365. And we have put our employee wellness coach and staff are a part of our employee experience service line as well. And I think really I've not seen, because I don't go on the units, I try to stay off of the units except at midnight when I like to walk around and talk to the staff and try not to disturb the patients. But I think that is an area where I see VR as a potential opportunity, is on those acute inpatient units where they have disturbed sleep because people are checking on them all the time. We love our staff. We want you to check on the patients. We want our staff to be taken care of, but we also want to take and tie back in that we need to take care of our veterans in any way that we possibly can. Over in our CLC, we have had some opportunity to use VR, and it's just amazing to see the reactions of our veterans when they have that chance to do it, and our staff. And kind of the reaction that you were bringing about is, it's just amazing. And just to see the smile or hear the laugh that maybe you've not heard for some time come out of this individual.
Yeah.
And you get that laugh out of them because they're having so much fun, they're enjoying it, or a gasp because they've experienced something that they have never experienced. And so, I'm not in direct patient care, but, I do like the opportunity to walk around, and I really see where we need to take and truly expand the use of our virtual reality capabilities and spread it as far as possible across the organization.
And I think Dr. Clancy said it beautifully this morning, joy of experience. Yeah. And I took that note down very quickly. And I wanted to just add a couple of examples from my own direct patient care experience with VR. One is an immersion where we do it in a group setting in the inpatient mental health unit. And although, and this started during COVID, and it was socially distanced, so we would do 4 veterans at a time. Even though the experience was individual, they had their own headset, and they couldn't see what other people were doing. What would happen is they would all get on the same experience, and they would be competing with each other. And we would hear roaring laughter about, and this is gaming, but not tour of duty. This is, balls in the air and knocking down snowman and stuff. And just that level of empathy that can come out in those experiences. And veterans also, well, you should try this experience. You should try this experience. And we also saw that in our CLC. We would work with the veterans individually, and so they really didn't know who was doing the VR in their room. But the next time we would come to see them, they would say, well, I really want to do such and such because so-and-so told me, because they have such a fantastic experience. They get that form of relief and they want to share it. And I think that that's really unique about the veteran culture and in the inpatient experience, is that they do it not just for themselves, but because they know that it contributes to the greater good. And I think that that's just extraordinary about this population of human beings. So I'll pass it back to you, Barry.
I just have to accent what each of you had said, the power of connection. And I think we know that, the connection between veteran to veterans, when veterans make a connection with another fellow veteran, or veterans within their community, and also between employees. And I think that's one thing Dr. Rumsey and I found when we were doing the employee well-being sessions, is that we start with a focus, hey, heads and headsets, hey, come try VR, hey, this is really fun, this is cool. And sometimes there's a sense of, oh, technology, wait, technology, where's technology? And invariably, it opens up another thread of connection, another thread of conversation that may not have happened otherwise. And so in a way, it actually accents the interpersonal connection, and it doesn't, take away the technology. It's actually giving us a reason to have a deeper connection. And that connection, I think, brings us back to work every day. We have that connection with our fellow employees. We have a connection with the veterans we're going to see. And that connection is what makes us feel good about being at VA and coming back to work. So how about, what do you see next? Where do you see this technology going, and where would you like to see it going? And I think I'm going to start with you, Tracy, again.
Where do I want it to go? I would like to see this everywhere. There's so many applications and possibilities. And kind of like you, I may be the oldest member of my ELT at Orlando, but I am the tech geek. And, if there is an opportunity for a new piece of software, if there is a new technology, they usually are like, so have you tried this? Have you done this? And I'm like, no, I haven't, but I'll be happy to do so. And so, just any opportunity, I think if we can take and really expand getting headsets out there, making a suite of software available to our veterans and to our staff that, they can take and get a code and just be able to log into it, standardize how we take and utilize this across the organization, the full VA enterprise, so that if I am a traveling veteran and I'm coming from one VA to the next, and I have a headset but I'm having difficulties with it, do I have somebody that I can go into in the VA and get some help with that? Just having those types of opportunities, I think, because this is not going away. I can only see this expanding and continuing to grow over the years. And even though, I can still get out and exercise and move about and, do all the things that I want to do, at some point, as a veteran, I'm going to need more care, and I'm going to be looking to the VA to take and help me, get that care. And for me, this is just one of those tools and opportunities that if we don't really continue to move forward and move more quickly, we're going to lose a sector of our veteran population that we could be providing services to, but we're not going to get to them. And I think the use of VR can be done in a lot of different ways, not just through, hopefully, the AR that's available, but, how can we take and use this and expand it from being VA Video Connect? How can I do this through my headset? And really feel that immersive opportunity and it, really puts you right there with your provider. And so that would be something that I would really like to see VA, who's always in the lead for most everything, really take the lead on this and really engage it and make it something that, every veteran, use it for our OC Health, maybe with our staff too. So, if they need to have a COVID test done, well, let's talk. Get on your headset. Let's talk. Let me look at you for a minute, and then let's go from there. So there's just way too many applications to even think about, using them more in our CLC for engagement, more for our physical therapy. If I don't have time to take and come in, but I can meet with you, and you can take and walk me through this, through my VR headset. So it's just limitless.
We had a prior conversation with Dr. Rumsey, and if we had more time, it'd be lovely. But the vision of Tracy's that one day every veteran will have a headset in their home, and that will be a moment of pride for those veterans saying, I get my care at a place, they care so much, I have a headset, and I'm using it for this, and it's integrated, and it's, that's Tracy's vision, but when you spoke it, it's just like, wow, wait a minute, 1,200 to 10,000, yeah, that's tremendous, and then we think, wow, what if one day, and it's a beautiful vision. Thank you. David, how about you? Where would you like to see this going?
Well, I continue as we have everybody here and everybody that's seeing this virtually. I think it's only going to continue to grow as hardware gets better, as applications increase, as technology improves. It's only going to get better. And for me personally, where would I like to see it go? Again, I would like to see every veteran that needs a headset has one. Yeah. Get it to our rural veterans that are unable to get to our medical centers, be able to provide the care that they need, whether it be medical, physical therapy, occupational therapy, whatever it may be, so that we can get that access to our veterans, because they deserve the access that others have as well. So those are really my goals on how we can improve this. And again, I'm kind of selfish from my standpoint as a PT or a physical therapist assistant, that I want their rehab to be fun. I want it to be enjoyable. Get that buy-in by that veteran to do their exercises and get better, and also maintain a fitness for life, like the National Veterans Golden Age Games preaches, of keeping you active, keeping you moving, keeping you healthy.
Thank you, David. Dr. Rodenkirk?
So right now I'm exploring sending headsets home to patients. I have 2 that I'm currently doing it with, getting some feedback from them. We have a PT, OT, KT, rec therapy kind of sub-channel in XR, and I'm hoping that we can all share a little bit more in there. I want to just bring up something Dr. Greenleaf mentioned in his talk on Tuesday of the morph, changing technology, seeing yourself as an older self, and tying that into our whole health, our wellness programs within the VA. And in that research, they found that we don't recognize ourselves 10, 20 years down the road. So having that camaraderie with yourself as an older adult can change how you eat, how you exercise, how you save for retirement. And so I would love to see some programming around that. And I'm currently right now working with a Australian VR company who is connected to Lorimer Mosley and his team in the Explain Pain research that they're doing. And they've combined so beautifully pain neuroscience into movement so that it makes sense to move, which is often something that's very difficult to do when you're living in chronic pain. And if you create the value and the education and knowledge for the patients and for the veterans when they're moving, it just ties into their own values in a whole different way. I'd love to also see more headsets available, and I'm so glad I've met so many companies these couple of days, and also beautiful how some have really created movement in their programs, and so that's something that I also see just being developed moving forward.
I think that's amazing. So we're right at the end of time. Anne, do we have time for any questions? Maybe one question? One question? There's one in the back. And thank you. That was so helpful, and what a joy to be up here with you all.
Hi, I'm Matt Solis in VHA Prosthetics. I just want to sort of put a plug out there. As the uses for VR move to the home for veterans, prosthetics is going to be an increasingly large part of that. We're at every single site, and we have heads too. So as you're trialing this stuff, please think about prosthetics. Please walk down there, invite them to be a part of this, get them to use it, get them involved and invested in veterans healthcare. Have them observe a clinical, interaction with the veteran if possible. And, I think it can only help sort of this team approach as we move to the future. Thank you.
Thank you. That is amazing. And yes, we'll be down to prosthetics quickly. Yeah. So we just want to say thank you so much for participating in the panel and sharing your information and your wisdom with us. I think that has been so gratifying to learn more about what's happening across the VA. So thank you.